Hi, my name's Dave Holmes and welcome to CyclingPhysio.com. Today we're going to talk about knee pain, and we're going to have several episodes about knee pain. This is part one, and we're going to talk about the most common cause of knee pain now, and that is lateral quadricep IT band, which stands for the iliotibial band friction syndrome. It's very common in runners. It's actually sometimes called runner's knee. But in cycling, it is probably the #1 injury that we see that isn't caused by a crash. Now, essentially what results is knee pain, but the cause has nothing to do with the knee. Almost always, lateral knee pain or pain on the outside of the knee is caused from an imbalance in the hip. What we have to look at first is what is the structure that's involved, what is its role, and why is it breaking down? The iliotibial band is this thickened band of fascia that runs down the outside of the quadricep and attaches below the knee. It has some fibers that protrude up into the kneecap as well, and its role is actually to bring the thigh in and out. It stabilizes us when we stand, it kind of holds our hip up, keeps it from collapsing down. Now, that is a job that is best done with the deep muscles of the hip. Now, you're going to hear me say this over and over and over again on this website. The glutes are almost always becoming weak. Now, the reasons the glutes become weak, there's a lot of them, and I think the #1 thing is we sit on them all day, and it's hard to use a muscle you're sitting on. So what we have to understand is that these muscles, for one reason or another, will stop doing what they're supposed to be doing. We become uncoordinated in them, they don't function properly, and we still go about being active. And so other muscles have to take over, and what happens is the iliotibial band starts to do too much work. Okay, we start driving and controlling the knee on the bike from the iliotibial band rather than the muscles in the hip that are more efficient to do that. And when that happens, now all of a sudden we get excess tension through the outside of the knee, and where it crosses the bone of the femur here, the bone kind of jogs out that way in what's called the lateral condyle. It rubs back and forth against that condyle, and it starts to get frictioned. And it's almost like a blister that develops on the inside of the body. I imagine it gets quite red. It certainly gets raw and sore to the touch, and it can stop you in your tracks. So we're going to talk about a few of the ways to get rid of this lateral knee pain. Okay? But it's important we understand what we're actually after is we have to relieve the stress and tension on this tissue, or it isn't going to go anywhere.